Hi, everybody. Good afternoon, and thank you for joining me wherever you are. This month's talks from the naturopathic doctors at Rio are all on the theme of mental health. And in many of my other talks, I've gone into detail about the mind body connection. For today, I'm going to do a deeper dive into the mind portion, specifically the chemistry that's involved in the brain and how that affects our mood and health. Specifically, I'll be talking about neurotransmitter balance. For those who are joining, perhaps you can name some neurotransmitters. Examples include things like serotonin, dopamine, Gaba, acetylcholine, epinephrine, also known as adrenaline. So these are all examples of neurotransmitters, which are chemical messengers in the nervous system. And their job is to relay signals within nerve cells or neurons in the brain, as well as other organ systems in the body. There's a structure in around our brain called the blood-brain barrier. It's quite a tongue twister. Just try saying that 3 times fast. Blood-brain barrier. I already started distorting the words. So I'm going to refer to it as the BBB. The blood-brain barrier is located within the capillaries. These are the tiny blood vessels that deliver blood to the brain. The BBB is just a single layer, a very selective membrane that allows safe molecules into our central nervous system. That's the brain and the spinal cord, while keeping those that may harm us out. However, the BBB also has a way of transporting these neurotransmitters out to the periphery, out of the brain, into the peripheral nervous system. These are the nerves that branch out from the spinal cord and the brain, the central portion. So each of the neurotransmitters has a unique set of functions, and they interact with one another and nerve cells in a very complex and not fully understood manner. However, researchers have been able to link certain neurotransmitter abnormalities, so excess, deficiency, or an imbalance of the various neurotransmitters to a variety of conditions, illnesses, and specific symptoms. And more importantly, what may be of interest to you as in the audience is that researchers have found ways to impact or change neurotransmitter function and observed positive downstream effects in test subjects. The brain is capable of recycling, and it often reuses components of one neurotransmitter to make another one. And there are sets of neurotransmitters with opposing or complementary functions. For example, Gaba, and the full name is actually gamma aminobutyric acid, we'll just call it Gaba, and glutamate. The brain uses glutamate to produce Gaba, which is a calming or inhibitory neurotransmitter, while glutamate itself is excitatory. Gaba is helpful for things like sleep. Perhaps you've tried chewing a tablet if you have trouble falling asleep. It's also, due to its calming effect, been helpful for students before a test, or if you have a presentation or something that you're feeling anxious about, to help with that sense of calm and relaxation. So anyone who is anxious regularly may benefit from more GABA or have a deficiency. The symptoms of GABA deficiency and glutamate excess actually may overlap. It can be hard to tell which is dominating. Further, GABA controls muscle activity. So a deficiency of GABA may result in things like muscle pain or headaches. It's also an important part of the visual system. As already mentioned, low levels may be associated with anxiety, chronic stress, depression, insomnia, difficulty concentrating, because it is inhibitory. So if there's not enough, it's not balancing all those excitatory signals. And in an extreme example, overstimulation by signals can result in conditions like epilepsy and seizures. Low GABA can also appear as memory problems. And as we progress through this talk, you'll see that there's a lot of overlap of symptoms and functions of the different neurotransmitters. So at the end, I'll offer a way to help tease out the differences and maybe determine what neurotransmitters you may be deficient in or have an excess of. Another set of neurotransmitters that have complementary effects are serotonin and melatonin. As you may already know, melatonin is produced at night in response to dark conditions, and it's important in regulating the body's biological clock, especially the sleep-wake cycle. On the other hand, serotonin is involved more specifically in wakefulness. But in terms of sleep, it can help trigger sleep onset and also deeper quality REM sleep. Symptoms of serotonin deficiency may include things like, again, anxiety and depression, which we saw with a potential GABA deficiency, but also things like aggression and impulsive behavior. These could be a symptom of dopamine excess as well. Again, insomnia is coming up, irritability, low self-esteem and sexual desire, poor appetite, and many more. Physiologically, serotonin constricts the blood vessels and can help to bring on sleep. The supplement 5-HTP is a precursor to serotonin. And there are many things that can impact our neurotransmitter health. One of the most hard-hitting ones would be recreational drugs, as well as pharmaceutical medications to help correct some of these imbalances, such as antidepressants, also known as selective serotonin reuptake inhibitors, and there's a few other different classes. Ecstasy mainly increases serotonin in the brain, leading to those good euphoric feelings. The last neurotransmitter that I'm going to go into detail about is acetylcholine. Its role is in activating smooth muscle contractions and glandular secretions, including mucus, which I've been talking a lot about in the month of September. But it not only affects secretions of mucus, it also affects hormone secretions. Unlike serotonin, it relaxes most blood vessels. Serotonin constricts. The only blood vessels it doesn't relax in the body are in the lungs, so it bronchoconstricts. And acetylcholine also slows heart rate. It is the chief neurotransmitter of the parasympathetic nervous system. That's our rest and digest side of things. I already mentioned how ecstasy increases serotonin in the brain. Well, nicotine mimics acetylcholine and binds to the nicotinic receptors so that acetylcholine is blocked. But unlike actual acetylcholine, the amount of nicotine isn't regulated by the body, only by the user. When nicotine binds in place of acetylcholine, the receptor is temporarily inactivated. It can't bind to anything else, and it's desensitized to additional incoming acetylcholine or nicotine too, which explains some of the tolerance that occurs with smokers. If you continue smoking or vaping, or even being exposed to secondhand smoke, this desensitization is prolonged. In fact, chronic smokers maintain high enough concentrations to deactivate these nicotinic receptors and slow the recovery of the neurotransmitter function between cigarettes, which helps explain why the first morning puff is often the most satisfying. Sleeping allows time for those receptors to recover and become resensitized to the effects of nicotine and acetylcholine. However, when all the receptors wake up the next morning, there's not a lot of acetylcholine available around for them to bind to because they're used to having so much nicotine occupying them. And this causes the vicious cycle of chain smoking to avoid the feelings of agitation and discomfort that come with unengaged nicotinic receptors. So we know that cigarettes have a relaxing physiological effect through the action of dilating or relaxing our blood vessels and slowing heart rate. It takes the edge off, right? But it also promotes mucus formation. Before, we said that acetylcholine is involved in glandular secretions. So in smokers, long-term, there's often issues with hypersecretion of mucus in the airways, and compounded with the contraction of blood vessels in the lungs, this can lead to things like bronchospasms and coughing. Nicotine dependency develops pretty quickly. This is due to the repeated stimulation of nicotinic receptors, but also the continuous stimulation of nicotinic receptors actually increases the amount of dopamine that's released as well. There is, multiple things happening. And there's an additional substance in tobacco smoke, not only the nicotine, that inhibits something called monoamine oxidase B. MAO is also a neurotransmitter. And this enzyme breaks down dopamine. So when there's not as much of this enzyme, then more dopamine is available in the system. Dopamine is known for mood and control of complex movements as well as coordination. And the loss of dopamine in an area of the brain known as the substantia nigra is seen in Parkinson's disease. An important function of the cholinergic system, which acetylcholine is part of, is to regulate the sleep cycle. Both low acetylcholine and high glutamine, not glutamine, that's an amino acid. I meant glutamate or glutamic acid. This is another neurotransmitter. These both play a role in Alzheimer's disease and other degenerative brain conditions like ALS or Lou Gehrig's disease. Acetylcholine helps with things like arousal, learning, short-term memory. Glutamate is the most common neurotransmitter in the brain. It fires things up. It's excitatory. It's also involved in learning new information and the formation of short-term memory. As brain cells age or senesce or die, they release large amounts of glutamate, which can have an overstimulatory effect on the remaining healthy brain cells. And this exerts an excitotoxic effect when there's too much stimulation that can actually damage cells and even cause cell death. Glutamate sounds like something that you might find in your diet. And that's because the structure is very similar to monosodium glutamate. That's maybe where you've heard it before. MSG. MSG is a common flavor enhancer in processed foods. I think for a lot of people, restaurant food, notoriously East Asian or Chinese cuisine, conjures MSG memories, hopefully not too negative, but it's also used in processed foods. Certain meats and canned foods as well will involve MSG. I personally have seen it a lot in the ingredients list for chips and crackers or other snacks, and sometimes it's called something else, usually pretty close to monosodium glutamate or MSG, but it can also be labeled as E621, so just note that. That's just a part of the European classification system of permitted food additives, and it just is the number that's been assigned to it. So MSG is the same as E621. The adverse reaction to those who are sensitive to MSG is pretty similar to what's seen with excess glutamate in the body. Since it's excitatory, it stimulates nerve cells to get messages across. With MSG, people sometimes complain of headaches, flushing, sweating, and neurological symptoms like numbness, tingling, or weakness throughout the body. Chest symptoms, pain, fluttering, palpitation of the heart, perhaps nausea, sleep disruption. I've definitely experienced that. High glutamate symptoms are things like pain amplification. So for some people, MSG intolerance manifests as like facial pain or tightness, swelling, anxiety, restlessness, and an inability to focus also occur with high glutamate or MSG. And another condition that's associated with high glutamate, besides Alzheimer's and ALS, is depression and low cognitive function, specifically those in people with type 1 diabetes. Because glutamate can actually be built from a glucose molecule. Earlier, we talked about how components of neurotransmitters can be recycled. So glutamate to GABA, but also from glucose to glutamate, just for the body to be more efficient and conserve energy. Depression can result from chronic pain, we know, and so lowering glutamate levels can both reduce pain and help regulate emotions as well. When these neurotransmitters, GABA, glutamate, norepinephrine or adrenaline, serotonin, acetylcholine, when these are not in balance, which is often the case for many people, general mood disorders like insomnia, anxiety, depression, as we've talked about, for multiple neurotransmitters occur, as well as things like bipolar disorder and symptoms like obesity, weight issues, migraine headaches, altered pain sensations, ADHD, autism spectrum disorders, changes to hormones, adrenal function, etc. An imbalance can actually be present long before some of these symptoms or conditions manifest. So you might be interested in how you might detect this early on. By measuring or assessing the levels of neurotransmitters in your body, you can help yourself identify any underlying neurochemical balances that may be affecting your mood and health. There's a few different kits on the market, and they can use saliva or urine. I see urine increasingly to measure the level of neurotransmitters. There's been demonstration of a correlation with neurological conditions and levels of neurotransmitters. However, I just want to remind everyone that correlation doesn't equal causation. So neurotransmitters in the blood are filtered by the kidneys and then excreted intact as urine. However, many experts argue that assuming what's in the urine is actually reflective of what's happening in the brain can be a bit of a stretch. Currently, we don't offer any of these neurotransmitter kits at Brio, and I'm not convinced that they're worth the investment at this stage in development, but I actually have recommended to many patients a paper-based test. And it's known as the Braverman test. And you can access this for free at bravermantest.com. And it's an informative activity, but also kind of fun. I would be really curious once you get your results, if you feel like sharing by posting in the comments about how you were assessed through the Braverman test and if it really correlated to your symptoms or maybe some conditions that you experience. So the Braverman test itself consists of a questionnaire, and it will take you less than 10 minutes to fill out. And there's questions about memory and attention, physical traits that you possess, character, personality, and it approximates what your dominant neurotransmitter nature possibly is, including, again, symptoms that you may notice, certain tendencies or issues that you might struggle with, too, if a certain neurotransmitter is in excess. So that's in part one, finding out what your neurotransmitter nature or dominant pattern is. And secondly, there's a section on helping determine if you're deficient in any of the neurotransmitters. So there's more than 4 neurotransmitters, but it really focuses on serotonin, dopamine, Gaba, and acetylcholine. And yes, if you're wondering, you can be deficient in the neurotransmitter that governs your nature, as well as deficient in multiple neurotransmitters. And some people find that their numbers are pretty close between a couple in terms of both dominance and deficiency. Lastly, in the final portion, there are some suggestions of nutrients and herbs that you can use to boost any neurotransmitters that have been identified to be deficient. And on the flip side, maybe if you have symptoms of excess of a neurotransmitter and you look at the list of things that are suggested for deficiency, those are things maybe you want to avoid supplementing or consuming with to not further enhance the excess. So in these recommendations, dosages are given depending on the severity of your deficiency, but I would take this with a grain of salt, with some caution. Before taking any new supplements, you always want to check with a qualified healthcare provider to ensure that it's safe for you and won't interact with anything else you're taking, prescription or not, and that it won't worsen any pre-existing conditions. So the neurotransmitter Braverman test is not meant to really assess. The results should be interpreted with a healthcare provider and avoid self-treating without further expert guidance. So that was a quick introduction to the main neurotransmitters in our brain and that are working throughout our body, how a deficiency or imbalance of some of them may affect how you feel and even be involved in the manifestation of certain health conditions. And finally, I offer you a way of getting a little look into your body just based on what you've observed in yourself, in your tendencies, in things that you are susceptible to, how you feel, and how you see the world. And that's through the Braverman test. I hope you found this helpful. If you have any questions or comments, feel free to pop them in the comment box, and I'll see you later this month for another talk. Bye, everyone.